Good afternoon and welcome to the June 25th Community Update. My name is Stacy Wood and I serve as a Public Information Officer here along with Dr. Mullendor and Fletcher Tove, who will be providing updates to you here shortly. To reach our Spanish-speaking audiences, this Community Update is also available in real time in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Let's go ahead and get started with an update from Dr. Mullendor.
Good afternoon. As of noon today, there have been 523 lab-confirmed cases of COVID-19 in Buncombe County residents. 92 of these individuals are currently in isolation. 51% of those who have been diagnosed with COVID-19 in our county have been between the ages of 18 and 49. Across the country, there has been an increase in COVID-19 in young adults. While the illness often is less severe in younger people, some do get very sick and some do die. Younger individuals also may be more likely to show no symptoms, yet still spread the virus. Anyone can be infected with COVID-19 and spread it to others, even seemingly healthy people with no symptoms. All of us, regardless of our age, need to take this pandemic seriously and take action to keep ourselves from being infected and spreading that infection on to others. There are now outbreaks at 7 long-term care facilities in Buncombe County. An outbreak is considered to be 2 or more cases in a facility. Sadly, 37 Buncombe County residents have died from COVID-19, including 32 residents of 3 long-term care facilities that are experiencing outbreaks. Buncombe County Public Health is aware of over 15,500 COVID-19 tests that have been performed on residents of Buncombe County and staff who work in long-term care facilities in Buncombe County since the start of this pandemic response. COVID-19 symptoms may include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, new loss of taste or smell, nasal congestion, runny nose, nausea, vomiting, and diarrhea. Testing is available for those who have any of those symptoms of COVID-19, as well as those who are without symptoms or do have those symptoms and have had close contact with someone known to have COVID-19, or those who may have been exposed to COVID-19 as a result of their occupation or activities. We are also encouraging individuals in historically marginalized populations that have been disproportionately impacted by COVID-19, so Black, Indigenous, and people of color, to get tested. If your healthcare provider does not offer testing, contact one of the local urgent cares or clinics offering testing in our community. This information is available at buncombeready.org. Buncombe County Government and Western North Carolina Community Health Services will offer community-based COVID-19 testing in several locations throughout the county over the next 10 weeks. These sites are primarily for drive-through traffic, but are located in close proximity to the bus line and will be open on varied days and hours. To prevent and control the spread of COVID-19 to older or high-risk adults, it is important that people who work in long-term care or congregate care settings get tested for COVID-19. So designated times for staff of these long-term care and congregate care facilities will be offered at the two testing sites, one on Tuesdays and one on Thursdays, from 9:30 to 10:30 a.m. The locations, days, and times of these community testing sites are as follows. East Buncombe at 2217 US 70, Swannanoa in the Ingalls parking lot, every Tuesday, beginning June 30th. Testing for the general public will be from 10:30 in the morning until 1:30 in the afternoon. At Southwest Buncombe at 58 APAC Drive in West Asheville at the Buncombe County Sports Park, every Thursday, beginning July 2nd. And again, testing for the general public will be from 10:30 in the morning until 1:30 in the afternoon. And then in central Buncombe County at AB Tech, on Genevieve Circle, in the Allied Health Building parking lot, every Sunday, beginning July 5th. And that testing will be from 1:30 in the afternoon until 5:30 p.m. As a reminder, there is no out-of-pocket cost for the testing at these community testing sites, but we do ask that those who have health insurance, including Medicaid or Medicare, bring their insurance cards with them. To those who are looking for practical advice on how to stay safe during this global pandemic, here's the advice that I offer. As a respiratory virus, COVID-19 spreads through coughing, sneezing, and even speaking. So face coverings or masks are recommended for people who are around others outside of their immediate household or in public, especially in areas where keeping 6 feet of distance from others isn't possible. The best thing we all can do to get our economy and schools back open is to wear a face covering when you're out and about. Wearing a mask or a face covering, as Secretary Cohen said the other day, is a simple but powerful action. One of the most important actions that each of us can take to gain control over this virus. If you must go out, don't go into large crowds. Keep that distance of 6 feet or more between yourself and others. Every contact counts, so continue to reduce your contact with others outside of your household to keep your risk lower, and wash your hands. You have the ability to protect your friends, your family, our entire community, and our economy by following these simple steps. Slowing the spread of this pandemic means getting back to work and back to school. We can all do this, and we can do it safely. Thank you, and stay safe.
Good afternoon. I'm Fletch Tove, Public Health Emergency Preparedness Coordinator. Yesterday, Governor Cooper signed Executive Order number 147, which will go into effect this Friday at 5 p.m. Buncombe County will be fully aligning with Executive Order number 147. This new order extends phase 2 of reopening for 3 more weeks until July 17th. This means that for the most part, things for the next 3 weeks will look just as they have for the last 5 weeks under Executive Order number 141, which put us in the phase 2. The safer at home recommendation still stands. Mass gathering limits remain at no more than 10 people indoors and 25 outdoors. Restaurants, pools, and retail businesses will continue to operate at a 50% capacity with additional guidance. Salons, barbers, and other personal care services will also continue to operate at 50% capacity under additional guidance. Some industries, such as bars, gyms, indoor fitness facilities, and entertainment venues, must remain closed. North Carolina and Buncombe County will look very similar next week to how it looks this week. There is, however, one large and important change. As part of Executive Order Number 147, Governor Cooper has mandated the use of face coverings statewide. This means that people are now required to wear face coverings in public spaces, whether inside or outside, when physical distancing of 6 feet is not possible. This requirement is applicable but not limited to retail business, restaurants, personal care, grooming, and tattoo studios, child care facilities, state government employees, transportation, manufacturing, construction, and agricultural settings, meat and poultry processing plants, and long-term care facilities. If you're outside by yourself or with your immediate family, you do not need a face covering. But if you will be passing within 6 feet of others when outside in public, you are required to wear a face covering. There are some exceptions for this face covering mandate. A face covering does not need to be worn by workers, customers, or patrons who meet one of these following exceptions. Persons with any medical or behavioral condition or disability, including but not limited to any person who has trouble breathing or is otherwise unable to put on or remove a face covering without assistance. Persons under 11 years of age. People who are actively eating or drinking. People who are strenuously exercising. People seeking to communicate with others or someone who is hearing impaired in a way that requires the mouth to be visible. People giving a speech for broadcast or to an audience. People working at home or in a personal vehicle. And if someone is temporarily removing their face covering to secure government or medical services or for identification purposes. A person who that would be at risk from wearing a face covering at work, as determined by local, state, federal regulations or workplace safety guidelines. Anyone who has found that their face covering is impeding their visibility and ability to operate equipment or a vehicle. And finally, a child whose parent or guardian is responsible, or the responsible person has been unable to place the face covering safely on the child's face. If someone claims an exception, no proof nor documentation is required, but that business or vendor can determine how to best manage service delivery for that client. This means someone who cites an exception doesn't necessarily get service as usual. For example, someone who goes to a retail store and has an exception may be asked to remain outside while their requested goods are brought to them, or they may be brought in and restricted to a small section of the store. The business gets to decide how to best ensure service delivery to those clients with face covering exceptions. Citations related to this order can be written to businesses or organizations that fail to enforce this requirement. If a client tells the business they have an exception, the business can take that statement at face value and will not be cited. However, a business or organization that is blatantly disregarding this order can be cited and fined. Law enforcement personnel cannot criminally enforce face covering requirements under this order against individual workers, customers, or patrons. However, if a business or organization denies entry to a customer or client and they refuse to leave, law enforcement may enforce trespassing laws against that person. So essentially, we have 3 more weeks of phase 2, but now with a statewide mandate for face coverings. At that time, the governor will reassess our state data and metrics to determine the next steps for North Carolina, and Buncombe County will determine the best steps for Buncombe County. The 4th of July is just around the corner, and this year it will look very different for us. Our cookouts will be limited to smaller groups. We'll be wearing masks and keeping a safe distance from our families, friends, and neighbors. We're also going to have to enjoy fireworks in a different way. As we start to reflect on the significance and meaning of the date July 4th, I want to make a point. Other than voting, wearing a mask when in public is the most patriotic thing you can do this year. Across the nation, a common enemy is ravaging our most vulnerable, and each and every one of us has the capacity to fight back. In fact, the only way we can fight back is if we all work together. Our weapons in this fight are the 3 Ws. They're the best tools we have to combat COVID-19. Wear a face covering, wait 6 feet apart, and wash your hands with increased frequency. This is a small sacrifice to protect our most vulnerable. A summer of small sacrifice so that our children can return to school safely in the fall. A summer of small sacrifice that we continue to open up our economy to support our local small business, so that we don't go into flu season with our healthcare systems being unduly burdened, so that we can protect those most at risk, whether they are family, friends, coworkers, or even those we have never met. So be a patriot, wear a face covering, and as always, stay safe, stay smart, and let's take this step by step. Thank you.
Thank you for tuning in today to the community update. We will provide the next community update on Thursday, July 2nd at 2 p.m. There are a variety of resources available at buncombeready.org for local businesses and industries looking for signage, and we will continue to add additional signage emphasizing the use of face coverings when in public. So please check buncombeready.org for this information, and thanks again for tuning in.